So in that unit, if a mother's healthy enough to go home but their baby is not, then that mother can stay with that baby outside of the postpartum beds, the after delivery beds,
Correct.
but stay with their sick baby for a prolonged period of time, so the baby doesn't need to be transferred to another
That's right.
hospital.
And sometimes even when moms do have to deliver early, sometimes really early, 23, 24, 25 weeks, once that baby gets to a point where they're called a grower and feeder, meaning we're not doing anything for the baby, but
That's
the
what I
baby's
call
not
my kids all the time.
they're not stable enough to go home. They can be transferred back here so that it's closer for the families. And so we try to work with, when we do transfer a mom at an early gestational age, making sure that our neonatologists here know to be in touch with those folks at either Duke or VITA in Greenville or UNC, so that if a baby's there when they're stable, they might be able to come closer to home.
So largely speaking, you can take care of almost the entire pregnancy population in our community.
Right. It's one where there are, unfortunately, medical problems that can happen at an early point in the pregnancy where a mom would not be appropriate to stay. And the main reason is because of the baby. Taking care of a 23 or a 24-week baby is very different than taking care of a 32 or 33-week baby. And so if mom is stable and the baby is stable as best as we can tell on monitoring, then we do try to transfer those moms while they are still pregnant. It is much better for the baby to be born in a hospital where they are more typically prepared to take care of a very premature
As
baby.
opposed to being born here and emergently
Transferred.
transferred.
That's right. And sometimes nature or medical problems have to necessitate delivery. And so sometimes we are able to call a transport team to be here for when that baby is born. Sometimes we have to stay, the neonatologist, not the obstetrician, but the neonatologist would stabilize the baby and then figure out where there's room. Thankfully in North Carolina we have multiple special care nurseries within close proximity. Unfortunately, sometimes some of them are full, and so we try to honor the parents' wishes in terms of where would be most convenient for them. At the same time, not only when, particularly if they're still pregnant, we're transferring a mom, there has to be a bed for her. There also has to be a bed for her baby or babies. And so that can sometimes have more of a factor in where mom can go for continued care than their personal
I would think
choice.
so. So certainly Nash's investment into the community and building the Women's Center has added to the quality of even your personal private practice.
Yeah, and it's a really lovely facility. Families like the spaciousness of it. They like being able to have visitors and have their visitors have plenty of room. Within some of the women, the labor and delivery suites, we do have bathtubs. We don't do water births there, but there are a multitude of different interventions for pain control. Only about 50% of our patients get epidurals. Certainly supportive of that. I'm not suggesting that you shouldn't get one, but some people want alternatives, and so we do have quite a multitude of options that are offered, as well as childbirth classes that are taught at the Women's Center and breastfeeding classes as well.
So it sounds like a complete service to the community. That's wonderful.